Hello, I'm Dr. Paula Baumann, and I would like to welcome you to the Indiana University East Campus and the nursing induction ceremony for the class of 2029. We are honored to have parents, family members, friends, and loved ones joining us as we celebrate this important milestone. Today marks the beginning of an extraordinary journey for our nursing students as they enter a profession grounded in compassion, knowledge, science, service, and leadership. The next 3 years will be challenging, rewarding, as they develop the skills, confidence, and professional values essential to providing exceptional care. As we welcome the class of 2029 into the IU East nursing program, we also welcome you as valued partners in their success. Your encouragement, support, and belief in these students will play an important role in helping them achieve their professional goals and prepare to make a meaningful difference in the health and well-being of individuals, families, and communities through nursing. I would like to welcome Dr. Gregory Dam, the Associate Vice Chancellor for Academic Affairs, to the podium to say a few words.
Thank you. Good afternoon. On behalf of Chancellor Rome and the IU East academic leadership, welcome. First, to the families and friends who've supported these students, thank you. Reaching this point required prerequisite courses, long hours, difficult exams, and persistence. It also required encouragement and sacrifice from others. You helped them reach this point, and your support will continue to matter in the years to come. To the students, congratulations. You've earned a place in the class of 2029. Admissions to the nursing program is an important achievement. It is also the beginning of a greater responsibility. By 2029, many of you will be caring for patients and families who will depend on your knowledge, judgment, and compassion. Your preparation for this responsibility has already begun and continues now. Consider the profession that you're joining. For more than 2 decades, the American public has ranked nurses first among all professionals for honesty and ethics. That trust has been earned each day by nurses who stayed late, noticed what others missed, spoke honestly to families, and cared for patients with skill and compassion. You now have the opportunity to strengthen that tradition and to carry it forward. The nursing faculty have concluded that you can do this work. Hold on to that, because there may be difficult weeks ahead. At times, you may question whether you belong here or whether they made a mistake in selecting you. When that happens, remember that the faculty admitted you because they recognized your ability and your potential. They didn't make a mistake. Take pride in what you've accomplished and approach what comes next with humility, discipline, and confidence. Congratulations on your admissions to the nursing program, and welcome to the class of 2029. I'd like to introduce now our Chief Nurse Administrator, Dr. Amanda Carmack.
Good evening, everyone. It is my distinct pleasure to welcome you to Indiana University East and to celebrate this important milestone for our Bachelor's of Science in Nursing class of 2029. Tonight marks more than a beginning of a nursing program. It represents the beginning of a professional journey dedicated to service, compassion, leadership, and lifelong learning. Each of you has worked hard to reach this moment, and you should take pride in the commitment, determination, and resilience that brought you here. Welcome to the nursing profession and the Indiana University East family. Absolutely welcome to our family. That's what it is here. You are joining a community that is built on trust. It's built on integrity, excellence, and a deep commitment to improving the lives of others. Nursing is both an art and a science, and it requires critical thinking and clinical expertise, but it also requires empathy, courage, and the ability to connect with individuals and families during some of the most significant moments of their lives. As you begin this journey, you will be challenged. There will be long hours of studying. There will be difficult exams, there will be complex clinical situations, and moments when you question your abilities. During those times, remember why you chose nursing. Remember that every lesson you learn, every skill you master, and every challenge you overcome prepares you to make a meaningful difference in the lives of your patients and also your community. We are committed to your success. Our faculty and staff are passionate educators who will guide and support you throughout your educational experience. Would our faculty please stand? Thank you. We believe in your potential and we are dedicated to helping you develop into competent and compassionate professional nurses. To the families and friends and supporters gathered here tonight, thank you. Your encouragement, sacrifices, and unwavering belief in these students have helped make the achievement possible. Nursing education is demanding. It's demanding for a reason. And your continued support will be invaluable as these students progress through the program. Tonight's induction ceremony symbolizes your commitment to the values and responsibilities of the nursing profession. While you have much to learn, you also bring unique strengths, experiences, and perspectives that will enrich our program. It will enrich each other, and it also will enrich our profession. We are honored to be part of your journey. As you look around this room, remember that these individuals beside you are more than classmates. They are future colleagues, collaborators, and lifelong friends. Support one another, learn from one another, celebrate each other's successes, and together you will form a community and some very unbreakable bonds. We talked about that this morning. On behalf of the faculty and staff of Indiana University East School of Nursing and Health Sciences, I congratulate you on this significant achievement and warmly welcome you into the Indiana University East School of Nursing and Health Sciences program. At this time, I would like to welcome Maria Kreitzer to the podium, who is our keynote speaker for this evening. She is a 2013 graduate of Indiana University East BSN program, so she was here where you were in 2013. Her nursing experience spans medical surgical, oncology, labor and delivery, postpartum, newborn, nursery, case management, and perinatal navigation. Her leadership journey has included serving as the nurse manager of obstetrics to her current role of nurse manager of labor and delivery, OB triage, high-risk antepartum, and the fetal care center at Good Samaritan Hospital in Cincinnati. She is passionate about compassionate care, nursing leadership, and supporting the next generation. Please provide a warm welcome for Maria Kreitzer.
All right, good evening, and thank you for that warm welcome. It is truly an honor to be here tonight, and if anyone would have told me when I was sitting in your seat during my induction ceremony that one day I would be here encouraging the future classes, I may not have agreed then. So this could be you, and I hope that it is. So again, my name is Maria Kreitzer. And as Amanda shared, Dr. Carmack shared, I apologize. I was a 2013 graduate here at the IU East BSN program, and that is something that I carry with me with pride daily. In my office space, there's a proud, very beautifully mounted degree from right here in this program. And I'm so excited to reflect on my journey as I encourage you in yours. So congratulations to each of you. I know exactly how hard you've worked to get to the seat that you're in. And so as you prepare to buckle up and take the next few years to become the registered nurse that you plan to be, just know you've already worked very hard to make it to where you're at today. And so we believe in your ability to be successful again. As you sit here tonight at the beginning of your journey, you may be feeling excited, nervous, confident, overwhelmed, combination of all of those feelings. You may also be wondering if you're prepared, if you're smart enough, capable enough, what is going to be coming in your direction on this journey. So here are a few things that I would like for you to remember from me today. Every great nurse started exactly where you are. Not with all the answers, not with years of experience and certainly not with confidence in every situation. They started as students, started learning, started unsure, and one experience at a time, they became the nurse that they are today. As I already mentioned, I graduated from this program in 2013, and I still remember sitting in this nursing school at the beginning of my own journey. I remember specifically sitting in an auditorium, and they said, by show of hands, what type of nurse do you plan to be? And we went through the different specialties, and we got to obstetrics, and there goes my hand. Most of the room raised their hand at that point. But truly, I had no idea where my journey was going to take me. And while OB ultimately did become my passion, and it's the place that I've spent most of my nursing career, I unexpectedly fell in love with mental health clinicals, loved the opportunities that I received here in this program. And when it came to the intensive care unit, totally fell in love with that. And in fact, Dr. Bauman was my capstone instructor as I spent a semester in the ICU. So it's okay to know where you think you want to go, but can I encourage you to open your heart and open your mind and truly take this opportunity as a student to explore all that you're going to have the opportunity to be a part of. As Dr. Carmack mentioned, my journey began in medical surgical oncology. And from there, I did have the opportunity to find my way to the labor and delivery unit, where we also were cross-trained as postpartum nurses, newborn nursery nurses. And from there, I was given the opportunity to serve in case management as a perinatal navigator. And at that point, that's really where I began to form informal leadership skills and working with multidisciplinary teams and representing patients at different stages of their pregnancy. And at that point, it became very clear to me that advocacy behind the scenes was truly where my heart was. So along the way, in serving in case management and providing advocacy for patients, as I mentioned, that's where my leadership skills really began to develop. So as I stand here today, I serve 3 different nursing units, and that's a composition of over 200 nurses and multidisciplinary team members. So as I mentioned, when I was sitting in your seat, you could have never told me then that at one point I would be responsible for over 200 professionals who report to me, and that it's my role and responsibility at the end of the day to make sure that we are delivering safe and quality care to our patients. There was no perfectly mapped out path for me from being the nursing student to the nursing manager that I am today. There were many successes, but there were also failures. There were opportunities that I was not sure that I was ready for. There were difficult shifts, mistakes, setbacks, and moments when I questioned myself. There have been seasons in my personal life where I simply didn't know if I had the strength that it took to be the nurse that I needed to be. Every part of the journey, though, has taught me something that I needed for the next step. We've all heard the saying, where there's a will, there is a way. I do not know words that are more true than that when I think about the nursing profession. After years of being a nurse myself at the bedside, and after years of having the privilege of leading nurses, one thing I know for sure, I can teach skill, but I cannot teach will. I can teach you how to start an IV, can teach you how to perform a physical assessment, administer medications, interpret fetal heart tracings, respond to emergencies, how to use equipment. And while those skills absolutely matter, I ultimately could not teach you the will to want to serve, the will and the passion that you have and the desire you have to be the type of nurse that you long to be. So I want to encourage you to always hold on to that will, your will to serve others, your will to provide compassionate care, your will to learn when things are difficult, your will to advocate when your patient's voice needs to be heard, your will to show up for your team, and a will to be successful and passionate in your nursing career. That will take you further than any skill ever could. And because skill helps develop the practice, just know it's the will that keeps the drive. I heard Dr. Carmack talk about the why. And so when the will gets tired, and sometimes it will, I, like she said, would encourage you to remember your why. Why did you choose nursing? Why did you apply for this program? What brought you to this room today? Maybe someone has cared for you. Maybe someone you love is a nurse or a healthcare provider. You never know anyone's journey, but I can assure you that if you take a few moments to understand their why, you would find motivation in yourself to remember why you are doing what it is that you're doing to become the nurse that you are going to be. Something that's been really beneficial for me is to write down my why and revisit that. And at the organization I work for, a part of the orientation piece is helping team members identify what their why is. And then they provide you with a little thing that you can put your why into. It could be a picture or a note, and then you can attach that to your badge because it's very important. And I promise you, you will remember me saying this to you on those late, long nights when you're studying for a test or preparing for a clinical rotation. We will not compare the size or the length of care plans that we had to do compared to what you all have the opportunity to do with technology. But it will be remembering your why that will give you the motivation to continue to pursue your goal. Truly make the most of being a student. It is stressful and it's difficult, but at the end of the day, it is incredibly rewarding. You get a front row seat to a career that you're chasing, and you get the opportunity to job shadow and take it all in without being the sole responsible person. And so enjoy that while you can. I remember soon after nursing school, I had the opportunity to work as a nurse aide while I was in nursing school. And one of my closest peers was the nurse. And we came upon a situation and I said, "What can I do for you?" And she said, "Get the nurse." I am the nurse. That will be you before you know it. So let's start, and let's not rush to that point yet, but really focus on your opportunity as a student. Take advantage of this season, as I said, ask all the questions and be curious. Volunteer when there's opportunities to be present. There will be a time when they need a helping hand for the induction ceremony. Take that opportunity. If someone says, does anyone want to see this? Go, raise your hand, get off the bench, be the first to volunteer. Do not measure the value of your goal or the clinical day only by this number of skills or opportunities that you checked off that day. Open your mind and your heart, as I said, for the many different ways that the healthcare model is delivered to our patients. You may enter a clinical convinced that that specialty isn't for you and leave fascinated by it. I did. I already shared that with you. I remember almost feeling afraid about spending a semester in a state hospital because I was unsure of what mental healthcare looked like. And I still reflect on that experience as one of the most meaningful because the truth of the matter is mental health healthcare is a part of every specialty. So truly, take advantage of the opportunities that are going to come to you. Do not be discouraged if you signed up for one type of clinical opportunity but you got something different. Just be willing to go with your whole heart and an open mind, and I promise it'll be meaningful to you. Pay attention to how our different disciplines communicate with one another. Watch how experienced nurses handle difficult situations. Notice the person who makes an anxious patient feel safe. Learn from the things that go beautifully, and also learn from the things that you someday hope to do differently. Clinicals is where nurses begin to move from something that you've read about to something that you're going to become. And I hope that you can be present for that. Respecting everyone at the table as you enter into your career as a healthcare professional is something that I can't stress enough. While you're learning, remember that another lesson will serve you if you pay attention to how you are serving others along the way. Healthcare doesn't happen because of one profession. It's certainly a lot greater than nursing. It happens when we all come together. So let me encourage you to respect the environmental service team members who keeps your patients' rooms safe and clean. Respect our maintenance and facilities leaders who are keeping our building operational and functional. Respect the laboratory, imaging, dietary, transport, pharmacy, respiratory, social work, nursing assistants, unit coordinators and technicians. Respect one another. Respect your physicians, your advanced practice providers, your educators, your leaders, your executive leadership. Every single team member has a very important piece of that puzzle. Learn people's names along your journey. It will mean a lot to your patients when you can recognize them by name. You can recognize those family members or support persons that are present. It's meaningful. So take the time to learn names and to say thank you for opportunities that you get to be a part of. The one thing that's really sacred about nursing school is while we're given clinical opportunities, it's truly the patient's choice if we get to enter into their space. So never take that for granted. That's a really delicate time for them. They're really vulnerable, and they allow us because they trust us and they want to help us become the nurses that we strive to be. So make sure that every interaction is something that means something to you. Excellent patient care, as I said, truly is a team effort, and it's amazing the confidence you're going to gain as a student to prepare you to be that independent nurse at the bedside. Along the way of nursing school and nursing itself, you're going to have incredible moments of triumph, as I said, and difficulties. Some of your greatest lessons, though, are going to come to you from moments that feel like you're not going to survive them. I've made decisions that I would like to make differently today. I've had conversations that I could have handled better. I've questioned whether I was ready for a responsibility that was placed in front of me. I've learned, though, that leadership doesn't always mean getting it right, and it certainly does not mean that I have all of the answers. And nursing does not require any perfection, but what it does require is humility and accountability, honesty and integrity. It does require you to be willing to say that you don't know, that you do need the help, that you did make a mistake, and most importantly, what can you learn from this? The nurses that I respect most today aren't the ones who never failed. They're the ones who have remained teachable even when they did. When you stumble, and at some point you will, do not allow that one difficult moment to convince you that you're not meant to be here, because you are. Learn from it, own what belongs to you, and keep going. There will be times when you become so focused on how far you still have to go to get to that class of 2029 graduation that you'll lose sight of how far you've come. I remember during nursing school accessing that unofficial transcript tab countless times, because what it meant to me is that if I could have accomplished passing and successfully completing all of those classes to get to the class that I was feeling that I was struggling in at that time, I could also add that to that same list, and I was going to be successful. So look for ways to remind yourself that you've come a long way to get to where you are, and stay focused in the present and not so hard set on what's to come. Pace yourself. I was thinking about opportunities as a nursing student, the impact that you can have on a patient and their family. I specifically remember being in the presence of a mom and dad who were giving birth to their first baby at a later point in their life. I remember the dad feeling incredibly tough to be present in that moment, and he passed out. And I remember the mom at that point just seeking someone's hand to hold, because it was a really incredibly scary moment. And I'm pleased to share with you that that patient and her family have kept in touch with me. I could tell you all about that little baby boy who's not so little anymore. He's very much grown and graduated high school. But that all happened for me as a nursing student right here at the IU East program. So never lose sight of the impact that you're going to have with families. Think about all the opportunities that you have, the evidence that's going to be behind you when fear starts to creep in, that you've already accomplished so much, and you do have what it takes to handle what's coming at you. And while you're learning to care for everyone else, can I really encourage you to make sure that you're caring for yourself? Your education matters. Your grades, they matter. Your patients matter, but you matter too. Take time for your physical, emotional, mental, and spiritual well-being. Rest. Spend time with the people that you love. Laugh. Move your body. Step away from the textbook sometimes. Ask for help as I've said before. Give yourself a lot of grace. For me, one of the most important parts of my journey has truly been my faith. There have been times, like I said before, when I didn't think that I had what it took, that maybe I wasn't the right person. And in those moments when I didn't have the answer, I would pray. I just shared with Dr. DeLumba that I prayed on my way in because I was feeling a little nervous about coming to talk to you all. But truly, times when I couldn't see what was ahead of me, I could trust God with what he had in store for the next step. Times when the path I wanted and the path in front of me didn't look the same, and how discouraging that was in that moment. But the faith that it was going to work itself out, and above and beyond anything I could have ever imagined, truly. Pray before your exams. Pray before the difficult clinicals you're stepping into. Pray for your patients and their families. Pray for wisdom. Pray for strength. And sometimes your prayer may simply be, God, just help me keep going. Something I've learned, though, both personally and professionally, is that some of the hardest seasons that are followed by breakthroughs, we couldn't see that there was going to be a breakthrough when we were walking through them. So when you're in the hard part, just keep pushing. Rest when you need to. Again, ask for help. I can't say that enough. And pray through it. There will be a time when people are going to be relying on you, and it will be your strength that's going to carry your patient and their family through. They're holding on to every word that you say, every facial expression that you give, the time that you give them, and the way that you made them feel. Sometimes it's the best day of their life, but sometimes it will be the worst. In obstetrics, I've witnessed the first breath. I've witnessed new families. I've watched answered prayers, devastating diagnosis, unexpected emergencies, and unimaginable loss. I've learned that excellent nursing isn't about what we do, though. It's about how the people feel that are in our care. Did we make them feel safe? Did we hear them? Did they feel respected by us? Did someone explain to them what was happening when they were feeling terrified? Did someone stay with them when there was nothing left to fix? Our patients, again, I'm sure you've heard this before, they may not remember your name, and they may not remember the time that it occurred, but I promise you they will always remember the way that you made them feel. Never underestimate the privilege of being the nurse that you are going to become. 13 years ago, as I said, when I was graduating from this program, I couldn't see the entire road ahead. I couldn't see the specialties that I was going to get to be a part of. I didn't think that graduate school was a part of my plan, and it was. And I completed my Master's of Science in Nursing while working full-time and mothering children, and it's all possible. I couldn't see myself becoming a nurse leader. When I first started in formal leadership, I had a team of about 30 people in a really amazing level 1 obstetrics unit. And I could have never seen myself leading a level 3 maternity center where helicopters bring patients and ambulances bring patients and leading over 200 people. It was this program right here that prepared me for that success. And you are a part of that. As I said before, just keep track of where you're at today and focus on the next step that's right ahead of you. Make the most of this experience. Ask those questions. Have I said that already? Stay curious. Really open your heart to what might be coming towards you. Take interest in what your peers are experiencing as well. Even though you're both at the same type of clinical specialty, your patients are different. So take the time to talk to your peers and learn more about their day and the things that they had the opportunity to experience, because that's also something that you can add to your plate of experience as well. The nurse that is someday going to be comforting the grieving family is sitting right here in this room today. The nurse who is going to notice the subtle change that saves someone's life is sitting right here in this class. The future educator that's going to be leading a group of nursing students is sitting among you. The advanced practice nurses, researchers, nurse leaders, advocates, they're all around you. None of you have to be those people today, but every great nurse started right where you are. So remember, When the going gets tough, the tough gets going. My dad always told me that. My dad asked me if this was going to be recorded. He would like to see this today. Keep your cheerleaders close to you. I promise you, it's in those difficult moments that they're going to root you on and help lift you up out of the valleys, and they'll be right there with you to share when you're on the mountaintop. Give yourself grace, stay focused, find what it is that centers you, utilize these amazing resources you have before you. Be really good to your clinical instructors, because one of the most amazing nurses I've had the pleasure of working with is going to be teaching you. And again, congratulations and thank you for letting me be a part of this very important moment.
Thank you, Maria, for that inspirational speech. At this time, we would like to induct the class of 2029 into the book of Indiana University East Bachelor of Science in Nursing. Each individual will sign their name in the book, like the students that came before them. This symbolizes their commitment to the profession of nursing and their welcoming into our family. Oh.
Zachary Evans. Callie Bolenbacher. Sydney Brown.
There it goes.
Casey Hill. Miley Chateau. Daisy Suggs. Sydney Patterson.
Shinachia Superstation, right? Yeah, see.
Leah Ross. Christine Clemens.
Thank you.
Katie Cooper. Bridget Mago. Janelle Holt. Amelia Evans. Shaden Toretto. Mariah Phillips. Cheyenne McKinney. Maddie Campbell. Kira Curry. Hallie Hughes. Chantel Mapandera.
You go sit down.
Lexi Snyder. Madison Terry. Abby Lumpkin. Maddie Holscher. Jessica Woolenweber. Madeline Dixon. Hayden Barris. Lila French. Aubrey Andre. Madeline Wilson. Lacey Burdette. Sydney Fellers. Chelsea Lang. Nancy Lopez Julian. Eden Quinn. Alexis Murphy. Rihanna Hedrick. Tiffany Horner. Jocelyn Collins. Ella Coddington. Caden White. Gus Upchurch. Jaden Locke. Quentin McIntyre. Sarah Weimer.
All right. I would just like to say congratulations to the class of 2029. So fabulous. All right. It has come to the part of the ceremony where it's time to take the International Pledge for Nurses. It's located in the back of your program. You will once again take this pledge at the end of your journey during the pinning ceremony when you graduate at the end of the program. So we're doing it when you're coming in, and we're going to do it again when you go out. I would like to ask the students to please stand. And I would also like to ask any nurses in the audience that would like to recite the pledge to stand as well. And please repeat with me. In the full knowledge of the obligations I am undertaking, I promise to care for the sick with all the skill and understanding I possess, without regard to race, creed, color, politics, or social status, sparing no reasonable effort to conserve life, to alleviate suffering, and to promote health. I will respect at all times the dignity and religious beliefs of the patients under my care, holding in confidence all personal information entrusted to me, and refraining from any action which might endanger life or health. I will endeavor to keep my professional knowledge and skill at the highest level and give loyal support and cooperation to all members of the healthcare team. I will do my utmost to honor the International Code of Ethics applied to nursing and to uphold the integrity of the nurse. Thank you. You may be seated. As we conclude this evening's ceremony, I want to leave our newest nursing students with one final thought. Tonight is not an ending, it's a beginning of something extraordinary. The commitment you have recognized this evening symbolizes far more than admission into a nursing program. It represents your decision to answer a calling to serve others, to advocate for those in need, to lead with compassion, and to make a difference in the lives of individuals, families, and communities. The future of healthcare will be shaped by nurses like you. We cannot wait to see the impact that you make. Congratulations, class of 2029, and welcome to the Indiana University East nursing family.